Hello everybody, my name is Amy Stevens and I would like to share with you my practicum experience at Jordan Health. Specifically, I would like to go over with you an overview of Jordan Health itself. I'd like to introduce you to Lynn Mall, my preceptor. I'd like to go over the functions and goals of Jordan Health's nutrition program and services. I'd like to talk about the government funds and legislation that affects Jordan Health. I would like to talk about the community nutrition actions and the activities of engagement that Jordan Health is involved with, and I would like to share with you the personal knowledge I gained through this experience. Here is a picture of the Anthony L. Jordan Health Center where I spent my time this semester. It is located at 82 Holland Street in Rochester, New York. And here is a list of all the other locations that Jordan Health has. They have a total of 10 locations in all. I did get to spend a little bit of time at Brown Square Health Center also during my time. Next, I would like to introduce you to Lynn Mall. She is the lead dietitian nutrition specialist at Anthony L. Jordan Health Center, and she was my preceptor this semester. The chief function of the facility and the main goals of the nutrition program can best be summed up through their mission statement. Their mission statement reads, "The center is dedicated to providing high-quality primary and preventative health care with a major focus on health education and wellness promotion and the requirement to meet or exceed patient/customer expectations. As a trendsetter in the delivery of urban health care, the center will continue its leadership role in educating healthcare providers, consumers, and the public in areas of cultural awareness and sensitivity with a special commitment to assuring equal access to quality health care for all." Specifically, the role of nutrition in the facility would be to provide nutritional counseling and to assist in the development of nutritional programs for patients with specific medical or nutrition-related problems, such as obesity, diabetes, hypertension, lipid disorders, or food allergies. They can identify problems associated with inappropriate dietary intake, such as poor pregnancy outcomes, food insecurity, treatment side effects, and other related problems. They can affect these through collaboration with other providers to identify and connect with patients in need of nutrition counseling. They can review the medical charts and lab values, look at their clinical assessments and their other data to help develop the patient's nutritional care plans. They can consult with patients and develop a report to collect information on dietary history, meal patterns, lifestyle, and food preferences. They can consult with each referred patient regarding nutritional care for specific medical and/or nutritional problems. They can chart the patient's progress in the medical record. They can consult with other healthcare providers regarding the lab tests, return visits, and referrals to other professionals within Jordan Health as needed. They can also help in the developing and planning of educational programs for patients with specific nutrition-related concerns, such as diabetes, hypertension, or high cholesterol. As a primary provider, Lynn is involved in group medical visit model program development and implementation, including plan development, interdepartmental coordination, patient recruitment and retention, group facilitation, data tracking and analysis, and ongoing quality improvement. In regards to worksite wellness programs, she is involved in the development and included in business survey and creation, topic building based on the survey responses, and program coordination and presentations. As a clinical nutrition counselor, she uses the nutrition care process to effectively deliver medical nutrition therapy. Lynn obtained her associate's degree in hotel and restaurant management through Paul Smith College. She then got her bachelor's in nutrition management at RIT, and she did her internship at Syracuse University. Jordan Health is a system of comprehensive health centers and primary care offices that serve nearly 30,000 patients in the cities of Rochester and Canandaigua, New York. What is known today as Jordan Health originally began as an individual center that was established to meet the needs and demands of Rochester's residents for neighborhood-based healthcare that was affordable and accessible to all. Today, their network spans Monroe and Ontario County. Specifically, the Anthony L. Jordan location on Holland Street serves over 14,000 patients each year, and encompasses adults, adolescents, pediatric primary care, OBGYN, HIV treatment, dental care, podiatry, mental health services, and WIC. All 10 Jordan Health Centers and primary care offices are federally qualified and accept most insurances. For individuals without health insurance, Jordan Health can provide a sliding fee discount based on household size and income. No patient is ever turned away due to financial need. Jordan Health will work with each individual to create a payment plan that is manageable for them. They also have financial counselors on site. All Jordan Health financial counselors are certified application counselors who are able to assist individuals in accessing health insurance marketplace made available through the Patient Protection and Affordable Care Act. With all that being said, most of their reimbursement does come from Medicaid and Medicare. In regards to support personnel, the dietitians on staff do not have any extra help. There's Lynn and Colleen, which are both registered dietitians, and then other than that, they do get interns through Syracuse, Reuters, and University of Delaware that do help them from time to time. Jordan Health is an independent, federally qualified health center with a Level 3 patient-centered medical home designation through the National Committee on Quality Assurance. Jordan Health receives funding from the National Resources and Services Administration of the U.S. Department of Health and Human Services. Jordan Health is a network of outpatient primary care offices with providers who follow a panel of patients. While independent, Jordan Health actively collaborates with the major hospitals and healthcare systems in the area to provide a total safety net of healthcare services. In regards to legislation, Jordan Health is affected by a lot of it. Any legislation that affects the federal qualified health centers or the Affordable Care Act or the repeal of the Affordable Care Act will all affect Jordan Health. Additionally, there is also legislation currently that is working towards moving from a pay-for-services model to move more towards a pay-for-performance model, which will also greatly impact Jordan Health. Unfortunately, to be eligible to work with Lynn, you must be a patient of Jordan Health. There is an insurance restriction that prevents any provider to provide care to non-patients. If they were to work with consumer groups or community organizations, they would not be protected under the Jordan Health Center umbrella. Jordan Health does a really great job of advocating for public action. Two examples would be through their hypertension group and their healthy weight and wellness group. These are groups that have weekly meetings that last for 16 weeks. In the hypertension group, the people are encouraged to talk about their successes and their setbacks. They get to meet with their providers, their caseworkers, and with either Lynn or Colleen on a weekly basis. And during each of these meetings, they also get to try new heart-healthy dishes, and they get to take home weekly recipes. In the healthy weight and wellness meetings, they include healthy body, healthy family, and healthy community education and lecture series. They have a public and academic focus on relevant topics that support Jordan Health's positioning. The way Jordan Health interacts with community or other health services can be seen through their association and their work with FoodLink and the Curbside Market, and also their support of the Monroe County Diabetes Coalition. With the Diabetes Coalition, they provide diabetes prevention programs to help teach participants strategies for incorporating physical activity into daily life and eating healthy. Lifestyle coaches work with participants to identify emotions and situations that can sabotage their success, and the group process encourages participants to share strategies for dealing with challenging situations. The way Jordan Health measures its quality assurance would be through random surveys that are conducted in the lobbies of all of their health centers. They also have a committee advisory board that is made up of Jordan Health patients that meet once a month. During my time at Jordan Health, I was able to help assist in counseling of patients. I was also able to help create a list of low-fat foods that would be used during counseling sessions. I was able to create multiple bulletin boards at different locations. I helped in creating a sodium matching game for the patients. I did create a sodium poster board that will be used for future demonstrations, and I was able to assist Lynn in tracking patient compliance. A few of the ways I was able to apply what I've learned to this practicum experience would be through the social ecology model. We all know that a patient's condition can be related to either dietary intakes, physical activity, or both. They can also be genetic, psychosocial, behavioral, or environmental. During counseling sessions, we would classify certain factors in regards to the proximity of the factor to the patient. For example, interpersonal relationships like family and friends could be more closely related to poor food choices if another person in the household is responsible for preparing the meals. Economic situations could influence a patient in regards to food cost or availability, which then could bring government, schools, and organizational policies closer through the need for programs like SNAP or WIC. In regards to grants, I learned a lot about the importance of them, and specifically in the strict research methods that are needed, and how the results can influence the community nutrition in regards to the funding needed to implement continued research or the funding needed to implement the changes that were proven to be needed. Lynn currently receives funding through a CDC grant, a hepatitis C grant, and an AIDS HIV grant. Also, I was able to apply some disease-specific MNT in regards to like pancreatitis, hypertension, diabetes, HIV, and there was even one case where we got to work with a feeding tube patient. During the time I was able to shadow Lynn at Jordan Health, it provided me with valuable exposure to a more ethnic, diverse population. Through their refugee and migrant population, their Spanish-speaking population, and also with individuals who heavily relied on public assistance, it was great opportunity. There was also the opportunity to witness the direct impact that RDNs can have with their patients. Through tracking patient compliance, I was able to personally witness the positive change Lynn was able to bring to her patients. And then lastly, it was a great networking opportunity, and it was the opportunity to meet a new mentor. Currently, Lynn is helping me secure a co-op opportunity that she believes will be perfectly fitted for me. This was overall an amazing opportunity and experience. And this concludes my presentation. Thank you very much for spending some of your time with me today, and I hope you all enjoy the rest of your day.